Arizona Republic published 11:58 p.m. Eastern Daylight Saving Time June 29, 2020. Arizona's state health director on Monday declared that hospitals could activate crisis care standards that guide the allocation of scarce resources to patients based on factors such as their likelihood for survival. The announcement by Dr. Cara Christ, the Arizona Department of Health Services director, immediately was met with criticism by advocates for people with disabilities who say the state's current crisis standards of care could result in discriminatory denial of life-saving health care during the COVID-19 pandemic. Disability advocacy groups, including the Arizona Center for Disability Law, the ARC of Arizona and the Arizona Center for Law in the Public Interest, say the state's crisis standards need to explicitly prohibit making health care decisions based on disability, perceived quality of life, age, underlying conditions and a person's need for disability-related accommodations. The advocates said in a written statement Monday that earlier this year they asked the Arizona Department of Health Services to clarify language in the crisis standards, but that nothing changed. Activating crisis standards of care would, among other things, protect hospitals from legal liability for triaging patients, according to a set of guidelines that take into account a person's likelihood of survival, the extent of their sickness and other factors. Decisions on who to treat or not treat happen when there are not sufficient resources to take care of all patients. A scenario of overrunning hospital capacity is what many feared could happen if places did not successfully slow the spread of COVID-19. Several hospitals have reported in recent days that they were activating surge plans as hospitalizations for COVID-19 grew. They reported converting floors and bringing in nurses from other places. Christ's decision to activate crisis standards of care comes after a Friday recommendation from the State Disaster Medical Advisory Committee, a group of healthcare experts that comes together to make plans for care and use of scarce medical resources during public health emergencies. Christ said the goal was to address space, staff and resource constraints within hospitals and to prepare for hospitals to surge and activate full staffing. She said it also gives healthcare workers some liability protection. In crisis mode, elective surgeries will be paused except essential procedures that do not impact the care of other patients. It gives the hospitals a framework that allows them to determine if they do get short of resources, how they can allocate those, Christ said. Not all of our hospitals actually meet crisis standards of care just yet, so it was a proactive step by our hospitals. Governor Doug Ducey said Monday this measure will help Arizona battle the COVID-19 spikes in the state. We've been focused for 3 months for what is coming at us right now.